What I'm excited about with this gathering is that it's both interdisciplinary and interfaith. And I think interdisciplinary is so important because oftentimes we end up in these silos. And we can have somebody who understands humans from a biomedical perspective and what's happening inside of our brains, and someone else who's bringing a psychological perspective, or someone who's bringing a sociological perspective or a historical perspective, and all of these matter.
I believe in relationships and I believe in networks. I've spent much of my career as a member of and helping to build networks, and I think they're really important to try to advance critical and complex and hard work. And so I'm here to become a part of this really important network and to hopefully learn from the work and contribute to it.
Faith communities love helping people. And we discharge a lot of patients that could use a little extra support. So for example, the Anur Islamic Center we engaged, and they had several members in their congregation that owned restaurants. And we set up a program where there were patients who were discharged that had a hard time getting meals for like the first week post-discharge. The Anur Islamic Center would bring hot meals to patients who discharged. And they would bring meals to anyone of any faith. It wasn't particular to that particular faith community. So that's one example of engaging faith community networks.
The Quran tells me that God bestowed honor and dignity on every single person. As part of that honoring is to relieve them from pain when they are in pain, to comfort them when they're in distress, to be by their bedside when they feel abandoned. At the same time, the Quran tells me about religious diversity. So my job is not to make every person believe in one or two or three. My job is to be there to support and to recognize that diversity and to hold that as a central pillar of my work.
Not just respecting other people's beliefs and trying to operate in a sort of a culturally competent way in that manner, but trying to harness the power of people's lived experience as a reason to engage in health behaviors, or trying to tap into the power of faith communities to transform neighborhoods in all kinds of ways, but including community health, and to be true partners in health.
I hope that an outcome from this week of programming is that this conversation of faith and health becomes more mainstream. Ultimately, I hope that it becomes a part of the landscape of keeping people well.
I'm here because I want to be with like-minded colleagues, because I think we can band together and work and advocate for this. It can't be done by one or two people. We need to create advocacy for healthcare to be faith-based and spiritually based.
I mean, we live in a world where we understand that disease is physical, but illness is social. How we think about illness, how we think about it in relationship to ourselves, our communities, our relationships with one another. And so if we're going to talk about health and public health, then we have to take a social approach. And that's not just paying attention to the varying structures of race and class and gender privilege, but also the theologies and religious orientations that teach us how to think about illness. And so we can be positive framing institutions, or we can be negative framing institutions. But for good or for ill, religion matters when it comes to public health.